This video is looking at wrist drop and massage. Wrist drop wrist, radial nerve palsy, radial neuropathy are all the same thing. They're almost always caused by damage to the radial nerve, which then leaves the client unable to use their hand. A person with drop wrist will find they're unable to extend the hand or to raise the hand using the wrist. The hand or wrist might be weak and the fingers might also be affected. You'll also see that the radial nerve runs down the underside of the arms and controls movement in the triceps. It's also responsible for extending the wrist and fingers, and it controls some of the hand sensation. It's one of the 3 nerves that carry signals from the brain to the hand. An injury to this nerve can block normal nerve function. The person might experience widespread numbness and tingling throughout the wrist, the hand and the fingers. There might be wrist pain, tenderness or swelling, and pain in the forearm close to the elbow. Someone with a dropped wrist will find it almost impossible to turn their hand over, and there'll be a loss of strength and mobility, making it impossible to grab hold of anything, to control the movement of the hand. The client will also be unable to thumb a lift. The cause is usually physical trauma, infection, or exposure to toxins. In the past, when lead was used in paint, it was a common symptom of lead poisoning. It's also a feature of drinking too much moonshine or bootleg alcohol, where the chemicals aren't properly controlled and monitored properly. It can also be caused by a specific trauma to the nerves, such as a stab wound. It could be from a fracture of the upper arm, and even restraints being used. 2 common slang terms for wrist drop are used: Saturday night palsy and lover's palsy. Saturday night palsy is usually too much drink or drugs, when a person's passed out in a chair, arms slung over the back. Because of the drink, they stay in that position all night. The back of the chair puts pressure on and damages the radial nerve. The other cause, lover's palsy or honeymoon palsy, is falling asleep with a partner sleeping on your arm and not wanting to move. I used to laugh that off as to why you wouldn't just move someone if your arm was dead, till I had grandchildren, more than when I had my own children. If that 3-year-old's fallen asleep on your arm, you're reluctant to move your arm in case you wake them up. So maybe we need a new term, grandparent arm. You get the idea. People do usually recover fully unless it's something like a stab wound where the nerve is severed, but it can take anything from days to a year to resolve. In the meantime, you can't use that hand. Most often, if on waking one morning somebody can't use the arm, they will get medically checked. The first thought is more likely to be, is it some kind of stroke? So you'd usually only see people once they've been checked out, but there are some specific contraindications. Number 1, if the following symptoms occur alongside the wrist drop, then immediate emergency medical attention should be sought. Increased swelling or increased pain in the arm. We need to rule out any complications that could keep getting worse and cause lasting and serious damage. Any numbness or weakness of the face or leg, slurred speech, confusion, trouble speaking, walking or seeing. Then we need to be sure there's nothing untoward going on neurologically, including things like a stroke. And don't work on or close to the area where the nerve damage has actually taken place. You don't want to be putting pressure on there because you could cause more nerve damage. Treatments for wrist drop are usually conservative because ultimately the nerve just needs time to heal. The client's doctor or emergency room might splint the arm for support to prevent further injury from the hand just getting in the way, and the person will normally be given physiotherapy. So massage is part of a package, and our aim is to try and maintain muscle strength while the nerve repairs and to prevent muscle contracture, which could cause a much longer term problem. Gentle stretches can be included into massage treatments unless they've been advised against by the client's doctor. We're doing our usual hand and arm work here, but we're adding some additional stretches in, and that's what we'll show in our work with the client. We might, for example, notice when we work on our client's hands that the fingers are drawn upwards and inwards, not through any control of the muscle, but tension and contracture within the hand. So supporting the client's hand on your own and using your thumb, we make deep strokes from the base of the fingers across the palm to the wrist and then back. We'll show that now. So we'll just look at a couple of very specific moves for wrist drop. You can see here I've supported my client's hand in mine, and I'm kind of holding it open using my little finger entwined with his little finger and my thumb entwined with his thumb. And what I want to do is stretch this area, all of the thumb, out towards the wrist. I'm using a bit of lotion here rather than oil because oil will get a little bit too slippy. But I have just used a bit too much lotion. So I'm going to come across And you can see, because I'm holding the wrist out, any contracture that's starting to develop, I'm working against that, which is what we don't want. We don't want that contracture developing. So you can use slide. I can hold the client's hand like that. I can hold the thumb back and I can work this way. Now bear in mind, if the client happens to be pregnant, we're avoiding this area of the thumb, but we can still do this sliding workout. It's not going to matter if you fleetingly glance over that. It's sustained work there that causes the problem. You could, if you wanted, use a knuckle. It depends on the size of the client's hand. If the client's doing lots of manual work before they develop their wrist drop, then you might need to use your knuckles rather than your thumb, because even though there's currently no control over this area, you'll still have that muscular built up from before they develop the wrist drop. And finally, we just have a gentle wrist stretch. You can see Pete's resting his hand onto the table so that his hand can be nice and relaxed. With my opposite hand, I'm just restraining his hand. I'm holding it so that I'm supporting it there, and I'm going to intertwine my fingers. And all we're doing is moving the wrist around its natural movement. It might seem a very simple thing to do, but if you think with wrist drop, you've lost that mobility in the wrist. So what we want to do, the whole aim of this, is just to keep that wrist moving as it is. Now there might have been some pre-existing restriction. You can see there's a little bit there in Peter's. So it's a little bit jerky there. That was there already. So I'm not going to worry about that. What we want to do is just to keep all of this joint, all of these tendons moving, to keep the muscles moving, the ligaments, all of the connective tissue, while that nerve repairs, so that he can have the movement back in his wrist again. And again, this is something that you can teach your client to do at home, because the other option is that they could do it with their own hand. So they could use their good hand to move the wrist that's been impacted by the wrist drop. And so doing this just keeps everything moving while that healing takes place.